Hi, this is Dr. P. I'm a child and adolescent psychiatrist, and I want to walk you through how we actually diagnose ADHD in children, because this is something I get asked about a lot. There are really two main approaches we use here. First, the standard clinical approach. This is how most kids are diagnosed. Involves gathering information from the key people in your child's life. Parents, we talk with them about their behavior at home, their development, the family history. We also get input from teachers and how your child is functioning in the classroom and with their peers, and also feedback from therapists or other professionals. We also spend time directly observing your child in our offices, and we use standardized rating scales often to get information from parents and from teachers and to assess symptoms in a more structured way. We are looking at patterns of inattention, hyperactivity, and impulsivity that show up in more than one setting, like both at home and at school, and impact your child's daily functioning. Sometimes we recommend a second approach, which is called neuropsychological testing. This evaluation is done by a specialized psychologist using a series of tests to look at things like attention, working memory, executive functioning, processing speed, and learning strengths and challenges that your child may have. We typically consider this when the diagnosis is not very clear, or when we also have concerns about learning and we need a more detailed understanding of your child's cognitive profile. But here's an important point. Neuropsychological testing is not required to diagnose ADHD. The clinical approach, which I described earlier, just using the interviews, observations, and rating scales, can be done in the office, and it works well for most children. When we do use additional testing, it's really to better understand how your child learns and to guide treatment and school support. At the end of the day, diagnosing ADHD is always a collaborative process, and it relies on clinical judgment, input from multiple settings, and making sure that we're seeing the full picture. If you're wondering about your child, starting with your pediatrician or a mental health professional is a great first step. Thank you. Stay tuned for more information on ADHD.